Welcome to the presentation of Crohn's disease. In this presentation, the terms Crohn's disease and inflammatory bowel disease, or IBD, are used interchangeably. Crohn's disease, the inflammation which extends deep into the lining of the affected organ and can cause pain making the intestines frequently empty. Crohn's disease can be difficult to diagnose because its symptoms are similar to other intestinal disorders. About 20% of people with Crohn's disease have a blood relative with some form of IBD, most often brother or sister, sometimes a parent or child. Men and women are equally affected, and IBD most commonly begins during early childhood or adolescence. Researchers do not know what causes Crohn's disease, but many theories exist. People with Crohn's disease tend to have abnormalities of the immune system, but doctors do not know whether these abnormalities can cause the result in disease. The most common symptoms of Crohn's disease are abdominal pain and persistent diarrhea. In addition, a small percentage of patients with IBD suffer from certain types of arthritis, skin conditions, inflammation of the eye, liver dysfunction, and bone loss. Individuals with Crohn's disease may have a poor appetite with weight loss and fatigue. Rectal bleeding may be serious, persistent, and leading to anemia. The onset of IBD in childhood or adolescence may reduce the height of peak bone mass, resulting in increased likelihood of osteoporosis. A thorough physical examination and series of tests are required to confirm a diagnosis of Crohn's disease. There are numerous complications involved with Crohn's disease. The most common complication is a blockage of the intestines, which tends to thicken the intestinal wall with swelling and scar tissue, narrowing the passage. Deficiencies of proteins, calories, and vitamins have also been noted, which may be caused by inadequate dietary intake, intestinal loss of protein, or poor absorption. Gallstones and kidney stones can be common in patients with Crohn's disease. Currently, there is no cure for Crohn's disease, and treatment depends on the location and severity of the disease, complications, and response to previous treatments. The goal of treatment is to control inflammation, correct nutritional deficiencies, and relieve symptoms. The treatment for Crohn's disease may include drugs, nutritional supplements, surgery, or a combination of all options. Some patients have long periods of remission, sometimes years, when they are free of symptoms. Patients diagnosed with Crohn's disease will require long-life medical monitoring. The summary of symptoms in Crohn's disease include abdominal pain, diarrhea, rectal bleeding, weight loss, anemia, fatigue, pain in joints, and skin irritations. The educational implications of Crohn's disease include absenteeism from school more frequently due to ongoing medical care. Students may have loss of focus due to fatigue, pain, or emotional distress, and students may need extended time to complete homework. Students may require a personalized school schedule that accommodates their medical needs. For example, arriving at school later, leaving early, and time permitted to use the bathroom. Students may also require modified activities if experiencing a flare-up or recovering from a flare-up. Students may need to abruptly leave a class or activity due to frequent toileting needs. Students may experience periods of emotional distress and may require alternative schooling hours, depending on fatigue, physical pain, or emotional distress. Though students can usually eat a normal diet, they may need to temporarily modify their diet during disease flare-ups, for example by avoiding high fiber or spicy foods. Instructional strategies and classroom accommodations may include the need for unrestricted bathroom privileges and extra time for toileting needs. During flare-ups, allow extra time for work completion and modified physical activities, which may also be necessary. Students may benefit from assistance of a counselor or mental health specialist to help with the emotional issues that often accompany students with chronic health disabilities. Students may also benefit from the services of a school nurse or other qualified health professionals to explain the student's condition and develop an individualized health plan. Students may need to take medications during the school day to help control their symptoms. During flare-ups, students may need a modified diet. It will be important to work with the family, health provider, and school nutrition staff to make any necessary dietary accommodations. Resources include the Crohn's and Colitis Foundation of America and the Pediatric Crohn's and Colitis Association. Other resources include Young People in Chronic Illness, True Stories, Help and Hope, and the School Nurse's Source Book of Individualized Healthcare Plans.